And we're back. As we promised before the break, this segment we will be having a discussion surrounding World Diabetes Day, which is celebrated on November 14th. We have in studio with us right now the Public Relations Officer for the Belize Diabetes Association, William Dawson, as well as the Assistant Secretary for the Belize Diabetes Association, Pearleen Young-Reneau. Good morning.
Good morning.
Good morning, guys.
So it's a important conversation in this time. It's a conversation surrounding health. We know that we're in a pandemic where health issues are at the top for us in terms of priority list. But first, let's start with World Diabetic Day and what this day across the globe seeks to highlight.
Okay, well, as you rightly said, it's World Diabetes Day on November 14th, but the entire month of November is celebrated as World Diabetes Month. Okay, and the theme this year is access to diabetes care, okay, which we believe is a very fitting topic because many people do not have access to the proper care as it relates to diabetes, and the Belize Diabetes Association has been on an all-out sensitization and awareness campaign so that our people can be better able to cope with the condition. One of the things we've noticed is that when you're diagnosed with diabetes and you're in that 45 to an hour session with that doctor, when you leave, there's no support. And there are a lot of taboo ideas having diabetes in this country for many years. And so the Belize Diabetes Association has made it a priority to reach out to our citizens to let them know that there is care and support and that being diagnosed with diabetes is not a life sentence. We're at 463 million people worldwide have diabetes, and we're also finding out that 3 in 4 of those people live in low to medium income countries. So the poor class of people have a really difficult time accessing care and medication as it relates to diabetes.
How does those situations as it relates to poverty relate or contribute to the increasing number of reported diabetic cases? The disparities, how is it that it contributes to that?
Well, as we said, living in poverty is an anomaly that is evident that you can't access proper health care, proper diet, you know. There's a high level of stress. And so these things are contributing factors, and that's why it's important that the association reaches out to people. The insulin itself is very expensive, you know, and costly, and so we try to lend that support as it relates to the care.
As you said before, we're living in a pandemic. This has made the situation worse when it comes to diabetes because people are going through a lot. Some of them have lost their jobs. Some of them have lost loved ones. And as the stress increases, so does unhealthy living. People stress eat. And when you stress eat, you eat what is available. And most of the times, it's not the healthy food that is available. So we are seeing an increase in younger persons being diagnosed with diabetes. And we're also seeing an increase of complications due to those people who were managing and are finding it difficult now to manage their condition. They have less access to medical care. They have less access to medication. And so they're finding it difficult and the complication sets in. And as you know, with diabetes, all the organs of the body is affected. So it's from your eyes to the tip of your toes. So when you're not managing your condition, this is what happens. And now we have COVID to deal with. And so we are seeing an increase of persons with diabetes having difficulty in recovering from COVID. It's a viral infection. When you have diabetes, normally infections are very hard to fight. So when you have an infection like COVID that is very invasive, it makes it even more difficult to fight. And this is why we see more people with COVID having the underlying condition of diabetes, not making it. And it's a real situation. And that's why the best combative method is education and information.
I'm glad that you said that, if I can stick up in there. That being said, to put this into perspective, what has been perhaps the strongest message being sent by the association to its members?
Diabetes is a lifestyle condition. So it's sounds simple, but you need to change your lifestyle. Opportunities you can see in this pandemic, instead of seeing challenges, you can like turn them into opportunities. Simple example, you're locked in more, but you have access to the internet. Most people have television sets where they have access to YouTube. There are lots of exercises on YouTube that are free. So now you're at home, you have the television. Instead of sitting down and binge watching Netflix, you can tune into a YouTube video where you have daily exercise shows that you can get involved with. You and your family can do that. Also, because you're locked in, you don't eat outside as much, and fast food will become, less accessible for people who have to stay home. So it gives you an opportunity to make healthy meals for your family. The challenge there is, and I don't know how we can overcome it, is that when you go to the market, the healthier foods are more expensive.
Right.
So it's easier for you to buy a $3 kick down than to actually buy your vegetables and other things that would
whole wheat bread and
make
this and that.
whole wheat bread and things that would make. But it's making better choices in your daily life, making better choices. Getting up earlier, getting in that exercise, right at home. You don't have to go anywhere if you're afraid to come in contact with people. And also trying to teach your kids from early to eat healthier. I always say sugar is an acquired taste. You're not born to love and get addicted to sugar. It's introduced to you. So it's easier for you to get them from their small.
You know what's funny though? While you've mentioned the idea of sugar, so we've always held this belief that, okay, it's only from sugar.
No, it's not.
Right? I guess traditionally that's what we were told, right? Can't mix your tea too sweet, catch sweet blood, catch that.
Still got sugar.
Yeah,
Sugar, they say, we even call it sugar.
Call it sugar,
You can't eat too much junk food or too much sweets and stuff because of that. But at the same time too though, even if one were to eliminate eating junk food that contains excess sugar or what have you, or mixing the tea with too much sugar, but you're consuming
carbohydrates that turn
you're
into
still
sugar.
exposing yourself.
And that's where the education comes in, because a lot of people don't know that flour and different starches convert into sugar as it goes through your body, through your bloodstream, and so it creates a problem and your glucose level goes up. We have, and this is the other thing, I'm not sure who all knows about Belize Diabetes Association, but we have been in existence from 1991.
Yeah.
And we invite all Belizeans who have this issue or have family members that have this issue. Because myself and Mr. Dawson have not been diagnosed, but we have family members. So we joined as support to our family members.
I'm glad you said that, because I was just about to ask you, William, how did you get involved?
I have my son DeAndre, who had been diagnosed when he was 4 years old with type 1 diabetes, which means that his pancreas was not producing insulin any at all. So he was insulin dependent. And at that time, it was a very scary situation. Ms. Pearleen could tell you, being in and out of the hospital, missing work, it was very stressful. I had great psychological impact on both my son and myself and my family, of course, but even more so to him, who was a child, and as children, the regular things are you are involved in the sweet and the binge eating and that type of stuff of junk food. So it was very, very difficult. He's 20 years old, thankfully, doing well. Me and Ms. P were speaking about it, and we're so thankful to the Belize Diabetes Association for giving that care and support. And so in that regard, I have always been supportive of the Belize Diabetes Association and speak out on their behalf. But more so, it's a reality that 14.9% of our population has diabetes, which accounts for like 50,000 people.
Yeah.
So there's a large amount, and the scary part of it is that culturally, we've been shunning away from the issue of having diabetes. It's still a taboo subject. People are ashamed to tell you that they have diabetes. I can tell you over the years, hundreds of people have approached us and said, hey, come and join the association. Let's join in the fight. And they're like, oh, no, I have just like my medication and stay behind the scenes. But very prominent people in our country suffer from diabetes, in fact, around the world.
Yeah.
And so the Diabetes Association urges our citizens to get tested, become aware of the symptoms, the signs. When DeAndre was little, I didn't know better. He used to pee his bed a lot, was always thirsty and dizzy and weak, always very hungry. And those signs were not normal. But now that we know what it is, we encourage people to look for these symptoms in your children and even in yourself. You're going to the bathroom too often, you might want to check to see where your sugar levels are, and that's how important it really is.
Especially if your family has a history of having diabetes, because in my case, my mom died from complications with diabetes. There are 12 of us, and at least 6 of us are living with the condition right now. My husband was diagnosed, and he had to take insulin. So I know a lot of people in Belize know people who have diabetes, or in their own families who have diabetes. So it shouldn't be a taboo subject anymore. It should be something that can be talked about. You seek help. We have free glucose testing this month as part of our diabetes awareness. We have free counseling. For the glucose, you can go anytime and get tested, but for the counseling, you just need to make an appointment, and you can get counseling, because it is something kind of scary to find out that you have a disease that you will have to manage for the rest of your life. Or you can lose a limb, you can lose your eyesight. So it's easier to get support and to get the proper education. We have our monthly meetings. We're doing it Zoom now because of the COVID situation, but it's every month, every third Saturday of every month. You can tune in. We have healthcare professionals that give all kinds of good advice when it comes to managing your conditions. So the support is there. We only have even though over 50,000 adults, and this is between the age of 20 and 79, are living with the condition in Belize, we have over 600 members. So it's a small number of people who are accessing our services, where there's a huge population of people who should be trying to access some service.
When we think of diabetes, critical to the treatment, as you guys have rightfully mentioned, is a healthy lifestyle. So we speak about exercising, we speak about eating healthy. However, when you consider, again, as you rightfully said, the cost of healthy foods at the market, the healthy options, not everybody
can afford
that. And you've said that this seems to be a disease majority among low-income and poor families. How do we bridge that gap? How do you suggest we bridge that gap so that more healthier options can be made readily accessible and available for families and people that really need it?
I'm sure that's a discussion that has to be
On the
held
government
at a very high level.
But my thing is, a lot of the healthy food are grown in Belize. And that's always a question for me. Why is it so expensive to buy cauliflower and broccoli? We grow those. We don't have to import it anymore. We had the issue with the carrots the other day. There are so many things that is available at the market that can be less pricey if it's made known that our staple, for we Belizean staple for Sunday, the rice and beans, chicken and salad. The rice and beans are already the carbohydrates. The potato salad, the carbohydrates, right? I think it's just a matter of choice. Instead of buying this, you buy that. Instead of buying the potato, you buy lettuce and you make a healthy garden salad instead of making potato salad, because you already have rice and beans. Okay, so and then the way you pile your plate. We've always been saying
this. Because it's difficult to break tradition.
Yes.
Right?
Yes.
While we know what is healthy for us, if we've grown up in a traditional Belizean family where, as you mentioned earlier, rice and beans, chicken and salad is the order of the day for Sunday, that's what we wake up looking forward to. Yes. Much the same way as on Thanksgiving we expect turkey.
Right.
We've cultured ourselves to think, okay, this is what it is going to be based on day of the week, season of the year,
and then we eat rice almost every day. Like this is what I've seen, even where I work. You know, we have to bring the education that it doesn't have to be rice every day. There are some options you can use instead of having rice every day. But traditionally, that's what we do when it's lunchtime. We look for somewhere that's selling rice, something with rice. And so it's just like I said, it's a matter, a conscious matter of choice. You have to want to make yourself healthy. You have to decide that this is what I'm going to do today. I'm going to make myself healthy. We wanted to get into the schools, and this is another thing that we're pushing today. We have our first Zoom session with teachers and students. We've provided the link. We've provided the ID, and to all the schools, and all of them can log in. We have one today at 10 to 11, and then tomorrow, I think it's 2 to 3. But we're trying to get the education part in every part. And we have, well, right now it can't be done because people are going to school from home. But when school reopens, we're trying to get into the school and trying to have healthy snacks. If it's feeding programs, trying to see how they can rearrange their menus to have the kids eat a healthier meal. We've been trying our best to reach every corner of the country to try and give education. We're also donating medication and supplies as part of our celebration of Diabetes Month to healthcare facilities. But I always say prevention is better than medication and looking forward to complication.
Yeah.
So
it's cheaper as well.
Yeah, it's much cheaper. So it's you have to make that choice now. Personally, I've started to exercise. I've cut out soda from my diet totally, and I'm starting to see a difference. I know my family has this disease, hereditary. So it is even more important that if that's the case, you make that healthy choice, so you're here longer. And then with COVID, makes it even more important for you to start making healthy choices when it comes to eating and exercising.
As we wrap up, speak to some of the, and I know you made a mention of a couple, the activities that are planned for celebrating World Diabetes Day and World Diabetes Month, things that the wider community can also participate in.
Well, like Ms. Pearleen mentioned, most of our interaction is through Zoom, virtually, because of the COVID-19 regulations and restrictions in social gathering. Around this time of the year, usually, Isani would be buzzing with our ride out diabetes
and our walk,
and our youth camp, which is always a big hit amongst the youths. So most of our interaction is virtual, but more so what we are focusing on is the key aspect of having people know that it's not a death sentence being diagnosed with diabetes. It's a very manageable condition, like Ms. P alluded to. It's just based on lifestyle decisions.
You have to be on top of it.
You have to just be on top of your game. And you have to make a conscious effort to to identify that you cannot afford to be eating like Isani because you watch Isani plate and it looks buff. That's what our problem is. We're always looking at each other's plate, you know.
Right.
and that's something that
When
we
it
have
pile
to
up.
do.
Yeah.
And again, that's hard as a human being to do if you're already used to that culture of eating everything that you see.
Yeah.
And so we also have a culture where people run away from the healthy stuff. Back in the day, our parents gave us, you know, the sericid, the medicines,
Yeah.
the herbs. Children today are not really accessing that, and adults. So these are the things that we want to get to and let people understand also that out of that 50,000 people we spoke about who are diagnosed with diabetes, most of them are type 2.
Yeah.
So that's preventable and reversible if you access the right care and live a proper lifestyle. It's going to be okay. So we're not trying to frighten the nation with this conversation, but rather to advocate for healthier living. On a whole,
Yeah.
diabetes does not only affect one part of your body, it affects every part of your body. Your kidneys, your eyes, your hair, from your head to your toe.
Yeah.
You know, and so it's very important for us to sound the alarm, to open your eyes and make sure that you're aware of your status, especially if you have hereditary conditions that affect your entire family. You want to make sure that you're checking yourself out.
And I'd just like to give the number for the Belize Diabetes Association is 203-3333. It's very easy to remember. Just dial 20 and the rest of the trees. And we're doing glucose testing this month, so we want people to come in and access that service. We are trying to get people to get support because the team is access to diabetes care. So we're trying to push that, you know, that it's easy to access. Once you get the information, it's easy to access support and care. And like I said, education, information is better than medication and complication. So I'm urging all Belizeans who suspect that they might have this condition, frequent urination, excessive hunger, what is thirst? What are some of the other symptoms that they can look for?
Dizziness.
Dizziness and wounds that don't heal
Yeah.
the way they should. All of these are signs that you might have diabetes. So if these are what's going on with you, we urge you to seek medical help and then to come to us for support.
All right. Well, that's a great way to wrap up the conversation. We want to thank the Belize Diabetes Association for joining us in this conversation. With that, we'll take a quick break, and when we come back, we'll be hearing all about the University of Belize's annual expo. It's going virtual again. We're going to learn more about what that entails, so stay tuned.